Hello, everyone. My name is Terica, and welcome to my channel. I'm a nurse practitioner of 12 years, and I've had the opportunity to work in a variety of areas over the years. And I'm really passionate about helping people understand their health in a way that actually makes sense. And today, I want to talk about something that affects a lot of people, some diagnosed, some not even aware yet. And that's high blood pressure, also known as hypertension. Now, let me ask you this. Have you ever gone to the doctor and they told you your blood pressure was high? Or maybe you've been told before and you keep hearing, we're just going to monitor it. But nobody really sat down and explained what that actually means. So today, let's break this down in a simple way. Your blood pressure is the force of your blood pushing against your blood vessels. Think of your blood vessels like highways, and your blood is the traffic moving through them. Now, when everything is flowing the way that it should, there's no problem. But when that pressure gets too high, it starts putting stress on those vessels. And over time, that's where the damage can happen. And here's the thing. I've had so many patients over the years tell me, I feel fine. So they think they're okay. And I get it. Because if your body isn't giving you warning signs, it's easy to assume that nothing is wrong. But here's the truth. Just because you don't feel it doesn't mean it's not there. High blood pressure is one of those conditions that can be silent. No pain, no obvious symptoms, but behind the scenes, it can still be putting strain on your heart, your kidneys, and even your brain. Over the years, I've seen high blood pressure progress to the point where patients ended up with heart failure, some needing surgery, others ended up on dialysis, not because it happened overnight, but because over time the condition was not managed. Sometimes it was non-compliance with the recommended care plan, and sometimes it was simply because they had no warning signs. So they didn't think it was serious or they didn't think they were affected. And that's the part I really want you to catch. Just because your body is quiet doesn't mean everything is okay. So even when you feel okay, it still matters. That's why monitoring your blood pressure and managing it is so very important. Now, let's talk about treatment, because this is where a lot of people start to feel confused. When your provider prescribes medication, it's not random. Each medication works in a different way to help bring that pressure down. Some medications help your blood vessels relax. So instead of being tight and narrow, they open up and blood can flow easier. Some help your body get rid of extra fluid, because more fluid in your system means more pressure. And others slow down how hard your heart is working, so it's not pumping with as much force. Different people need different combinations because everybody's body responds differently. But here's what I really want you to understand. Medication helps, but it's not the whole picture. What you do every day matters just as much. For example, start paying attention to your sodium intake. That's very important. A lot of foods, especially processed foods, have more sodium than we realize. And that can cause your body to hold on to more fluid, which raises your blood pressure. Now, next, let's talk about movement, because this is another area people tend to overcomplicate. Being active does not mean you have to go to the gym every day or do some intense workout session. Don't overthink it. Something as simple as walking consistently can make a real difference. I'm talking about even just 15 to 30 minutes a day, uninterrupted, steady movement. That alone can help improve circulation, support your heart, and even help bring your blood pressure down over a period of time. You don't have to do anything extreme. You just have to stay consistent, because it's not about doing the most. It's about doing what you can and doing it on a regular basis. And let's talk about stress for a second, because stress can raise your blood pressure too. So finding ways to eliminate or reduce your stress levels matter more than people think. And your weight plays a role too. Even small changes over time can help take pressure off of your heart. And if you smoke or drink heavily, those are things that definitely affect your blood pressure in a negative way. And one of the best things you can do is actually know your numbers, your daily numbers. Don't just wait until you're at the doctor's office. Check it at home. Stay aware. Because when you know what's going on, you can respond early. And I know sometimes this can feel overwhelming, especially if you've been told you need medication. But it's not about fear, it's about awareness and taking control of your health. Small, consistent changes really do add up. And I always like to remind people taking care of your body matters. The word says in the book of 3 John 1 and 2, Beloved, I pray that you may prosper in all things and be in good health. That includes how you eat, how you move, and how you take care of yourself daily. So if this helped you, go ahead, like, share, and subscribe to this YouTube channel. And leave a comment below if this has helped you or if you have any other questions.